Hi, welcome to 5-Minute Videos. This is for the National Counseling Examination Review. This is Dr. Pepe going over Domain 2, Intake Assessment and Diagnosis. And right now we are going to be going over subcategory L, which states a screen client for appropriate services. Now let's first talk about the screening. So a screening is usually the first contact with the client in order to determine the appropriate program for the client and determining the eligibility of the client and kind of the where they could best benefit from. We talked about levels of care. So for the screening, usually the counselor or the therapist is looking at physical, psychological, social signs and symptoms. They're also identifying coexisting conditions. They might do assessments, or they could do different types of intake screenings. During this process, the clients also is being screened for appropriate for admission if it's a hospital, or if they don't require that type of level of care, then maybe outpatient services would be appropriate, and then you would be looking at a referral if you're doing a screening at a hospital or treatment facility. Another purpose of this is looking at eligibility. And again, if the client does not meet eligibility criteria, then you would talk about referrals or other options. And finally, you're looking at regulations. You're looking at state and local laws. You're looking at agencies' policies in order to determine what is appropriate level of care. So some examples of screeners are can be done with child custody cases. So when a person is determining level of care for a child. Job-related needs, sometimes with jobs such as jobs that require security clearance of some sort, then that could require a screening. Also, legal issues, if there's been, for example, a history of substance use or abuse, driving while intoxicated, then that can certainly instigate a number of legal issues. And then another reason for the screening request would be a court order. So usually the judge would court order a screening, or they might mandate counseling, a certain number of counseling services. So with that, it's important to keep in mind that when you're doing the screening, you have to be very mindful. You have to look at the different domains. You have to look at things like age, gender, income, place of residency, in order to determine how well that client is functioning. We talked about the GAF score. So that's also something to keep in mind. Also, the status. Are they a veteran? Do they have legal status in this country? Those are also things to keep in mind, as well as having sources to refer. So if the client is determined that partial hospitalization or an inpatient is not appropriate because of their GAF score, then you would be looking at outpatient services. And if you're working at a hospital of some sort, then you want to have referral sources where the client can feel like they can reach out to and receive the appropriate level of care that they are needing.